Welcome to Relax and Learn Medical, featuring 432 Hz music that may help you retain knowledge more easily. Today, we're diving deep into the fascinating world of the pancreas, a powerful gland tucked behind your stomach that plays a vital role in digestion and blood sugar regulation. Whether you're a medical student, a nurse brushing up on your anatomy, or just curious about your health, this video will guide you through the complete A to Z medical terminology related to the pancreas, one of the body's most underrated heroes. So take a deep breath, relax, and let your brain absorb this powerful knowledge, one word at a time. In our cells, pancreatic cells that produce digestive enzymes. Amylase, an enzyme secreted by the pancreas to break down carbohydrates. Autoimmune pancreatitis, a rare form of chronic pancreatitis caused by the immune system attacking the pancreas. In our cells, pancreatic cells that produce digestive enzymes. Beta cells, cells in the pancreas, specifically in the islets of Langerhans, that produce insulin. Bicarbonate, a substance secreted by the pancreas that helps neutralize stomach acid in the small intestine. Bile duct, a tube that connects the liver and gallbladder to the small intestine and joins with the pancreatic duct to aid digestion. Cholecystokinin, CCK, a hormone that stimulates the pancreas to release digestive enzymes. Chronic pancreatitis, long-term inflammation of the pancreas that leads to permanent damage. Cystadenoma, a benign tumor of the pancreas, often fluid-filled. Diabetes mellitus, a metabolic disorder that occurs when the pancreas does not produce enough insulin or the body doesn't use it properly. Duct of Wirsung, the main pancreatic duct that transports digestive enzymes to the duodenum. Duodenum, the first part of the small intestine where pancreatic enzymes and bile enter to help digest food. Endocrine pancreas, the part of the pancreas that releases hormones into the bloodstream, includes islets of Langerhans. Exocrine pancreas, the part of the pancreas that secretes digestive enzymes into the duodenum. Enzyme replacement therapy, PART, treatment involving synthetic pancreatic enzymes for people with pancreatic insufficiency. Fistula, pancreatic, an abnormal connection that may develop between the pancreas and another organ due to disease or injury. Fatty infiltration of the pancreas, a condition where fat deposits accumulate in pancreatic tissue, often related to obesity or diabetes. Glucagon, a hormone produced by alpha cells in the pancreas that raises blood glucose levels. Glycogenolysis, the process of breaking down glycogen into glucose, stimulated by glucagon. Gastropancreatic, pertaining to the stomach and pancreas. Hyperglycemia, high blood sugar levels, often due to lack of insulin. Hypoglycemia, low blood sugar levels, can occur from excessive insulin, hormones, pancreatic, chemical messengers like insulin, glucagon, somatostatin, and pancreatic polypeptide. Insulin, a hormone made by beta cells that lowers blood glucose levels by promoting its uptake into cells. Islets of Langerhans, clusters of endocrine cells in the pancreas that produce insulin, glucagon, and other hormones. Insulinoma, a rare pancreatic tumor that produces excess insulin. Jejunum, the second portion of the small intestine. It continues the digestion started by pancreatic enzymes in the duodenum. Ketoacidosis, a serious diabetes complication that occurs when the body produces excess ketones due to lack of insulin. Lipase, a pancreatic enzyme that breaks down fats into fatty acids and glycerol. Langerhans, islets of endocrine cell clusters responsible for hormone production in the pancreas. Laparoscopic pancreatectomy, a minimally invasive surgical removal of part or all of the pancreas. Malabsorption, poor absorption of nutrients often due to lack of pancreatic enzymes. Mucinous cystic neoplasm, MCN, a type of potentially cancerous pancreatic cyst. Necrotizing pancreatitis, a severe form of pancreatitis where parts of the pancreas die due to inflammation or lack of blood flow. Neuroendocrine tumor, PNET, a tumor that arises from hormone-producing cells of the pancreas. Obstructive jaundice, yellowing of the skin caused by blockage, often from a tumor, at the head of the pancreas. Pancreas, a gland behind the stomach with both endocrine, hormonal, and exocrine digestive enzyme functions. Pancreatitis, inflammation of the pancreas, either acute or chronic. Pancreatic enzymes, digestive proteins like amylase, lipase, and trypsin that help break down food. Pancreatic duct, duct through which digestive enzymes are released into the duodenum. Pseudocyst, a fluid-filled sac in or around the pancreas often formed after pancreatitis. Quadrant pain, LUQ, Pain in the left upper quadrant of the abdomen, often associated with pancreatic disorders. Retroperitoneal. The pancreas is located in the retroperitoneal space, behind the peritoneum in the abdominal cavity. Resection, pancreatic. Surgical removal of part of the pancreas due to disease or cancer. Somatostatin. A hormone produced by delta cells in the pancreas that inhibits insulin and glucagon release. Steatorrhea. Fatty, smelly stools resulting from inadequate digestion, often due to pancreatic enzyme deficiency. Splenic artery. Major artery that supplies blood to the pancreas. Trypsin. A pancreatic enzyme that breaks down proteins in the small intestine. Total pancreatectomy. Surgical removal of the entire pancreas. Tumor markers CA19-9. A blood test used to help detect pancreatic cancer. Ultrasound. Endoscopic or abdominal. Imaging test often used to visualize the pancreas and detect tumors or inflammation. And there you have it, a complete A to Z journey through the language of the pancreas. From enzymes and hormones to rare disorders and surgical procedures, the pancreas is truly a marvel of design, multitasking to keep digestion efficient and blood sugar in balance. Understanding these terms not only strengthens your medical knowledge, it empowers you to recognize how interconnected and intelligent the human body truly is. If you found this video helpful, please like, share, and subscribe to Relax and Learn Medical, where we make medical language simple, peaceful, and powerful.